Alhamdulillah. So you have booked your appointment or you're about to, and you are wondering what are the things that are recommended to do before you get hijama. So these are the pre-treatment and before care instructions. Now, number one, do not stop or reduce your medication without doctor's permission. Okay? This is very important. So some people think that before they come in for the hijama, they have to stop their medications or they have to stop taking their prescriptions without seeking permission from the doctor. We do not recommend you do that. We do not recommend you do that. Please do check with your doctor first if you have to stop your medication. Now, for some clients, like people who have diabetes and other conditions, we recommend you bring your medication. You might delay them a little bit and come with them to the clinic, and right after the session you can take your medication. Okay, next thing, do not eat for 2 to 3 hours, nor drink any alcohol at least 24 hours before your appointment. Okay, so no food, no water 2 to 3 hours before the appointment, and no alcohol 24 hours before the hijama appointment. So again, for those taking medications, if you're taking medications which needs to be taken with or after food, please wait and take your medication immediately after the hijama session with food to avoid any negative after effects like low blood pressure, like low sugar or low blood sugar, dizziness or lightheadedness, fainting, blurred vision, nausea, fatigue, lack of concentration, or maybe being in a state of shock. So these are possible negative side effects that could happen. So in order to avoid those, please do come with your medication and take food immediately after the hijama and drink your medication. Now, before you come, please do the following. Okay, before you come for your hijama session, please do the following. You perform a ritual ablution. You perform a ritual and ablution before the hijama session. Okay, this is sunnah, a ritual bath. So you make ghusl, which is the bath, showering to purify yourself, and also you make the wudu, the ablution, before the hijama. This is sunnah. You make the intention, and also you pray 2 rakats for healing and cleansing on a physical and metaphysical level. You may bring water or a snack meal. You may also bring 2 towels if you want to. But this is not recommended, as we do provide towels. But if you are still interested in bringing one, you may bring one. We provide towels, so you could, if you wanted to, bring 2 extra towels. But we do provide those, and we also do serve dates. But if you want to bring a snack and water, that's fine. We also do provide water. Now, children should be accompanied by a responsible adult with written consent from both parents for the child. And children here would mean any child that is 5 years to 18 years old or before they turn 18. So any of those should be accompanied by a responsible adult, and they should have a written consent from both parents before the child could get hijama. If you do suffer from any metaphysical issues, please do inform us. Also do inform us if you are pregnant or you are on your menstrual cycle, or you have any history of anemia, diabetes, low blood pressure, or issues like seizures. These are optional things to do. These optional but yet recommended. You could take a hot shower or soak your or hot bath, okay, rather. So a hot shower or a hot soak bath. You could soak your foot also in water. You could do a massage. Um, a few minutes on vibration machine also, or you could take a brisk walk or a quick jog. This would help move the blood around in your body and make it circulate before getting the hijama. And this is optional, you don't have to do it, inshallah. So possible rare reactions to be aware of: dizziness. Okay, so this could happen to some people after the session, so keep that in mind. Although we have it here in the pre-treatment and before care instructions, we do let you know upfront that possible reactions could be dizziness and lightheadedness. This can be due to low blood pressure and low sugar or anemia or any metaphysical issues. Also nausea and vomiting, shaking or seizures, blackout or fainting, and sometimes people do experience plasma and blisters. So these are possible reactions that a person could have from getting hijama. Inshallah, if you do have any questions, feel free to reach us, and we'll be sure to answer your worries. Inshallah ta'ala. Assalamu alaikum wa rahmatullahi wa barakatuh.